Hi, I'm Dr. Wolfe, and I'm here to help you improve the way you move. There are a lot of things that can cause knee pain, whether it's osteoarthritis, tendonitis, patellofemoral syndrome, or ligament injuries. Today I want to talk about patellofemoral syndrome. What does that refer to? Patella is the kneecap. So if you open up the knee, obviously it's this area here. That's your patella or your kneecap. Femoral refers to the femur, the largest bone in the body. And there are things that happen that can cause pain that change the tracking of your patella on that femur. If you look at the back side of your patella, there is a ridge that sits up. And that ridge should sit in the groove of the femur and cleanly move up and down when you bend and straighten your knee. However, if that ridge sits up to the side, inside or outside of the knee, and then it bends and straightens, it's going to rub the patella on that femur in a way that causes pain. There are a lot of things you can do to treat this, and we treat this every day at Mile High Physical Therapy. It is truly a tracking problem. The patella is not tracking correctly on the femur, and so we need to make that happen. There are two things we can do. We can change how the patella is moving, or we can alter the position of the femur so that it tracks in a better way to reduce pain. The analogy we use is it's like a train on a train track. The train is your patella or your kneecap, and the train track is your femur. You can change the train position, or you can change the track position underneath it. Here are 3 simple exercises that you can do at home to improve patellofemoral syndrome. It helps to improve the tracking of your kneecap over the femur to reduce pain. To improve the tracking of your kneecap, we like to do a banded chair squat. You place a band around your knees, make sure there's enough tension as you push your knees out, and then you simply do a squat motion and come back up. You'll do this repeatedly and make sure you are providing tension to the band as you go down and up. That will help to improve the tracking of your patella on the femur and strengthen the muscle on the inside of your knee. Another exercise we like to provide is to stretch your IT band and your TFL. Most people have heard of their IT band or their iliotibial band. It goes down the side of your leg. In order to stretch the IT band, what you do, if I'm going to stretch this side, is you cross your leg over that leg that you're going to stretch, and you press your hip toward the wall. You want to provide tension all the way down the side of your leg, across that IT band and the outside of your leg. You want to hold this for 30 to 45 seconds. And you'll do this at least 3 times every time you do it. The reason we do that is because the IT band becomes shortened and tightened, and that causes your kneecap to pull to the outside and track incorrectly. If you elongate those tissues along the outside of your leg, your kneecap can move inward a little bit so that ridge on the back of the kneecap can sit in the groove of the femur in a better position so that it reduces your pain and glides up and down in a more favorable position. Another exercise we like to provide to improve patellofemoral syndrome is a single leg knee bend. You would like to have a chair next to you for balance, and what you'll do is you're going to bend one knee and you're going to balance on the other leg and simply go up and down. The important part of this movement is to make sure this knee that you're balancing on is not going inward. We want it to stay to the outside as you go up and down. You can use a chair for balance if that's what you need to stay safe. If you can bring your hand away and go up and down, that's even better. If these exercises help to eliminate your knee pain, that's great. If they don't and you need to schedule an appointment, don't hesitate to reach out to us at milehighphysicaltherapy.com.